DESIblitz.com.
This virus is nasty. One of the main things it causes is pneumonia in the lungs, which makes the patient very breathless. Their oxygen levels drop. Normal oxygen levels are 97, 98, 99. Their oxygen levels can suddenly drop down to 82. 82, most people not be able to live with 82. And then, of course, the lungs are connected to the heart. The COVID, it does spread to the blood vessels in the heart. It can cause problems down there. It can cause problems with blood vessels elsewhere. So, it does cause kidney failure. It can affect mental functions.
We are, in essence, in the best interest of all of us, have had to resolve to taking away some of our liberties. We've been indoors, we've been have to stay away from everyone else, our loved ones, our families, which are things we cherish on a daily basis. We've not had any of those sort of opportunities or the happiness that comes from that, and we've had to deprive ourselves because of it. Because of the pandemic, in order to make sure that we come out of it and get our normality back as soon as possible, by reducing the transmission rates and making sure that our number comes down so that life can resume as best that can as soon as possible.
COVID, it exists. We've had lockdowns, we've had COVID tests, we have COVID vaccination. This is just a creation of somebody's imagination. I think that's very unlikely. But there are always a few people who will deny things. There's some people who still believe the earth is flat. There's some people who believe that no one ever landed on the moon. It was just a Hollywood studio. So, there are always going to be people like that. We want to try and do is make sure they don't influence the community at large.
One of the biggest changes I feel is the way we practice. Before the pandemic, patients used to be able to make an appointment, come in and see us on a regular basis with no problems. However, today things are quite different. It's triage first, which means that the patients call us and speak to a GP or another healthcare professional on the phone. We see if we can resolve those issues over the phone. Only if they absolutely need to be seen physically do we call them in to be seen, just to reduce the risk of them catching COVID from anyone else in that vicinity or from the contacts they may encounter in coming to the practice, and vice versa as well, to protect everyone and to make sure we can get back to life as normal as it can be as soon as possible.
So what we want to do is minimize contacts. So we reduce the number of face-to-face consultations and increase the remote consultations. So we can do consultations by text message, by video, by telephone, by email. Technology has enabled us to send certificates electronically. It's enabled us to send prescriptions electronically. So patients don't actually have to come in quite so much.
So for cardiology, we do echocardiograms, the ultrasound scan of the heart. We do put blood pressure monitors on, Holter monitors on. So all of those we're doing. We have neurology. That is just doctors face to face at this moment. We also have dermatology, where they still do investigation skin problems. There are other services we do in community, for example, ophthalmology. We work with Birmingham Midlands Eye Centre, and we have a lot of patients coming in. So we're doing like 7 days a week for that. We're doing X-rays. We do ENT, audiology. So there are a lot of different services. We work with the hospitals, and which are still we're still running, and patients are still coming in.
We do get patients worried, patients thinking that, because of COVID, we can't be seen. So we do emphasize that it's a COVID-free area, and temperatures checked on the day. They're wearing masks. Only a certain amount of patients are allowed in. Certain amount of patients are coming in. So it's a COVID-free area. So we do have a lot of things put in place for seeing patients on a daily basis now.
Quite a few of our doctors have started working from home during the lockdown. And on top of our normal work, we have to deal with a lot of anxieties as well. So there's a lot of telephone call, a lot of, we have to take our time to reassure our patients that they will get seen. We're still taking blood. We're still sending urine sample. We're still sending patients for X-ray, as usual. A lot of the services have been suspended, but, we use a lot of the advice and guidance. So if we have a patient we need to refer to the hospital, we refer them and they will advise us. We will send them a photograph. So, we're still referring similar number of patients as before.
My job is now to triage all those calls. So staff are taking calls, and I'm having to triage through every single call to make sure it goes to the relevant doctor or clinician that can deal with it. And I think the impact is such that we almost feel like we are like a call centre now. So we haven't got patients walking in, but the phones are constant. Personally, I've not had my hours cut, but we had to cut staff hours because there wasn't enough footfall walking in. Because of the COVID vaccinations happening, we are having to have increased hours, longer days, weekends, just to accommodate all these immunisations that we're doing.
I'm still continuing doing cervical screening. So obviously, like I said, baby immunisations. If anything needs to be done over the phone, we continue to do that via telephone consultations. Obviously, I'm now doing COVID clinics. So we're ensuring, obviously, the majority of our patients are being vaccinated.
What you may say is, but the elderly population aren't so tech savvy. They don't know how to use these website things. They don't know how to call you in. They don't know how to send photos in. We understand that. We know that full well. That's why we get a healthcare professional to speak to them the first time they call in, so that we can triage and see what it's within their abilities and how best can we deliver care to them so that they're comfortable in the way they receive it.
Things have been, more stressful. Every consultation is a bit more stressful. But I think we're getting through this. I don't know if they're particularly at higher risk of actually getting COVID, but once they get COVID, then their outcome is not so good. So, although there isn't any clear evidence that I know of that they get more COVID, but what we do know is once they get COVID, they have more deaths, they have more severe illness, they're more likely to end up in ITU. It may be linked to things like diabetes. The incidence of diabetes in Asians is probably double that of the Caucasian population.
Patients of the South Asian community have a higher health comorbidity with conditions like diabetes and vitamin D deficiency being more prevalent in our communities compared to every other community. I think beyond that, there are other reasons to it as well. We've known for years and years that health inequality is a big thing in this country, in a modern democracy that we call ourselves. It's a big problem, and we've known for years. And only has COVID-19 shed light on it in the public domain. Why have we waited this long? I don't know. With the higher burden of health comorbidity not being the sole reason, but also access to healthcare being another reason. we as GPs are expected to deal with patients in another language with an interpreter with different health beliefs and tackle those problems in the same 10 minutes we have for a British patient who we have a rapport with and able to converse easily with and understand it and are able to manage things on a much easier because the resource isn't there. No one's ever paid attention to this problem until today because, we've seen the death tolls and it is that serious. And even today, I'm not sure how much we are doing. Are we doing enough? I don't think so personally.
Here, I think we need to bear in mind that is the COVID is a severe illness in the elderly. So I think that's where we need to emphasize. They're the ones who are more likely to die from it. They're the ones who are more likely to get severe illness from it. And we need to make sure that they get vaccinated. Now, the vaccination rates for South Asians are 10 to 15% less than the Caucasian population.
The fundamental issue is our diet. It's what we eat. And I think that's the same across the board of all our South Asian communities, Pakistanis, Indians, Sri Lankans, you name them. We all have a similar diet full of oil and, greasy food, lots of carbohydrates, how much rice we eat on a plate. You just have to look and some people are shocked by it. But for us, it's normal, isn't it? But then that comes from the days when we were using manual hard-working labor where we were burning those carbohydrates off. But now the jobs that we're doing are far different. Most of us are in professional jobs, office-based jobs. Hardly many of us are, there are still a lot of our community that work in manual labor and, delivering services in the community. But unfortunately, because how available food is and how our diets have been for centuries, I think that's the reason one of the reasons we're disproportionately affected by diabetes. And I think that's an area that we need to target. We know that countries like Sri Lanka have reported much lesser cases than the UK and other Western countries and other countries, for example. Now, there are a couple of reasons that have been put forward for this, including, in some of those countries, they don't have the resources to have some sophisticated statistics to, report day-to-day real-time data. But then we also have to consider that those countries are less sparsely populated. People live quite further away from each other. There is some evidence or some research going into whether vitamin D deficiency for the South Asian and BME communities has had an impact on this. And that may be something that applies because obviously in the tropics, we've got sunlight, which means your vitamin D levels, even for people with darker skin, are adequate levels compared to in the Western Hemisphere where the sunlight is sparse and therefore we know there's an abundance of vitamin D deficiency.
COVID, it's disrupted the NHS greatly. So investigations which were being done within a matter of 2 weeks or 3 weeks, now they got waiting times of 200 days and so on and so forth because the hospitals are full of COVID patients. All the staff are being diverted towards COVID patients. So there's a big backlog. Patients waiting for, as an example, joint replacements. Patients who are having to wait for cancer surgery. Now that is a terrible thing because time is critical with cancer. You need a surgery in a timely way. You can cancel a knee replacement with pain and suffering, but it's not life-threatening. But a cancer is life-threatening. So I hopefully we'll be able to recover from this, and there won't be too much damage, but there will be some damage.
Someone's unwell with something serious like cancer. They may be immunocompressed, where they're more prone to catching infections than everyone else in the population. Now, if we were to take them into, for example, an operation and do something for them, they're obviously going to be in an environment which may be more exposed to COVID-19, like in a hospital setting, which undoubtedly it would be. And of course, they've also had something else on top, which like an operation, which would make things worse. So on balance, it's a very difficult decision to make. On balance, sometimes things have been delayed because of that multifactorial situation, not purely because of COVID-19 and the stress and pressure we're under on the front line to do with patients with COVID-19, who are serious, not purely because of that, but also because of these other factors. When patients come to see us, now, whether it's cancer screening in terms of the national programs or any screening for any serious conditions, for example, asthma or anything along those lines, we are still doing what we can possibly do within our limits and what's available to us to the best of our ability.
They're not being ignored. All I can say, they are giving more priority to cancer patients than other patients. But despite that, I feel there is a delay still. But they are given more priority than any other group of patients, simply because of his life-threatening nature or potential life-threatening nature.
In our area, because we are in a city, we have a lot of patients suffering from mental illness and anxiety, even before COVID started. With the lockdown, with the isolation, unemployment, uncertainty about the future, we've come across even more anxiety. So we have counselor, social prescriber, someone to talk to, someone to help them to relieve their tension. And we just by talking to them, we have talking therapy.
All the mental health services, they're still there. The services which were there before are still running. The only difference is those services are now being conducted more remotely. So we have got social prescribers, we have got care coordinators, we do still have access to psychologists, to counselors, and we do have access to psychiatric services. So those services are all still available, and of course they have access to their GP and all the staff here.
I support them by talking to them. So when I'm triaging them, some of them just need reassurance, just because they're worried about the whole COVID situation, symptoms, what they can and can't do. And I think a lot of them are going into like depression and anxiety and stuff like that. So it's just reassuring them, referring them on to the relevant. So basically every call that I make is taking a history of the patient, and it is passed on to a clinician, whether it's a nurse practitioner or a doctor. So they are being dealt with. I mean, I think one patient now gets at least 3 calls. So the initial call that they make, the triage that the office managers are doing, and then the clinician who actually calls them to sort out whatever is the issue is that they need sorting.
Interaction with anyone, friends, family, or those closest to you may be the first port of call if you don't want to reach out to us, as the service is here to help you, because you're more comfortable with discussing that with them, or you just want to run something past you, even if it's a fleeting thought. It's better to talk to someone about it than be there, lock yourself away, because these thoughts can and tend to propagate and get worse if you just sit there by yourself and you're not able to manage it yourself. Our reception staff and our staff in general are very knowledgeable around these things and may be able to signpost you. If you end up speaking to a GP or a healthcare professional, we can have a chat about what are the things that in your life that are making this particularly worse. How can we solve it and come up with some practical ways to address those issues? If we think that you may benefit from counseling, we may refer you for some support so that you can get some counseling. We may put you in touch with some charities that specialize in, for example, bereavement, like Cruise Bereavement, who can support you around what's happened in your life and the biggest things that have changed, which may have precipitated what you're going through at the moment. And so we're here to point you in the direction. And of course, if you need some medical help and some medications, because things are that bad, we're always there to help you as well. So we're here to point you in the direction. And of course, if you need some medical help and some medications, because things are that bad, we're always there to help you as well.
can't emphasize enough. I say to them, have the vaccination. But despite that, some of them, they just won't have it. So reasons I'm given are, I'm frightened, I want a few more people to have it before I have it. No problem has been identified with having the vaccine, but there's still that fear there.
There are lots of things we're doing. First of all, we're approaching, the elderly people who are vulnerable, who are eligible for the vaccines, to have those vaccines as soon as possible so that we can reduce the knock-on effect and to reduce the incidence of infection in our communities and therefore the spread of it. Now, there are a few ways we're doing that. First of all, is sending out text messages or contacting them to come in for the vaccination. The other things we're doing is, again, with our healthcare professionals, our colleagues, putting out information in their own language, with encouraging them to come in and have it done, putting out photos of ourselves, having the vaccine to say, look, we've done it. Surely we wouldn't do it if it was any risk to it, right?
Misinformation is downright dangerous. It costs lives. People out there who believe this misinformation and they base their decisions on that.
I think our only way to tackle that is to feed factual information as quickly as possible into the same circles to debunk those myths and hands-on approach. But unfortunately, as I've said before, because of the disproportionate resources that require us to tackle this problem, no one's really paid attention to this until now. Only now, because of the comorbidity burden and the mortality burden that have happened in these more communities, has the government actually paid attention and start looking at this issue. And I think they still have a long way to go. They've only just, scratched the surface with what they're trying to do. The biggest thing that has been highlighted is the long COVID syndrome, where patients who've had COVID at some point have ongoing fatigue, ongoing tiredness, an impact on, something like things like their lungs and the breathing if they had COVID pneumonia as such. Now, we've dealt with uncertainty in medicine year on year for a long time now, so we know how to deal with that. Now, we are still in the early days of understanding COVID-19 as a disease and its longevity and the effects it has. So we're in the process of understanding it, and the CCGs who are commissioning the services are commissioning services to focus on long COVID syndrome and patients suffering from long-term effects of having had COVID. So we are definitely addressing this issue and we will be ready.
But there is a 10% of patients who get COVID and then they suffer long-term. And this is well recognized. This is called long COVID. So anyone who continues to suffer after 12 weeks, they're labeled as having long COVID. And that may manifest in many ways.
Now, relating to that, the other concerns that will come to light will be poorly managed diabetes because of, disengagement with services, or because we've not been able to help them as much as we normally do, as well as, cholesterol, obesity. These are things that have been on our radar for a long time. But I think the pandemic, with us not being able to go out and do our day-to-day routines, our diets being impacted, will have a knock-on effect on these things. And obesity has been a big problem for some time now, hasn't it? And I've definitely seen a lot of patients who've said, doctor, I've put on weight since COVID. That's a big issue. We can't dismiss that as a concern because we know how big a concern obesity is, with its numerous knock-on into, including cancer risks and diabetes, cholesterol, cardiovascular risk. It's a huge thing.
5 things which will help in the community. I think it's very important that everyone supports each other. Show kindness to each other, to everyone. And that is not only good for the person you're helping, it's also actually good for the person who is helping. Nothing is better for mental health than actually going out there and helping other people in the community. Secondly, I would say keep in touch with each other. If you're not in a bubble, then do it by phone, by video. Teach the elders, your older relatives, how to use the internet so that they can communicate. They probably got smartphones already, but you could teach them to use the internet as well. You should exercise. It's good for your physical health and your mental health. And finally, please stick to the rules.
If I was to give you a few tips on how you can support each other and the community whilst you're living through the pandemic, I'd say, first of all, is follow the national guidelines. Make sure you're wearing a face mask and go out only and when you must and need to go out. Wash your hands when you're going out, before you leave the house, after you get in. Make sure that you're social distancing as much as possible for 1 meter or 2 meters where possible. And the other things I would also do is make sure that you check on family, friends, make sure they're doing all right, check on their mental health, just give them that extra little support, just keep in touch with everyone. So as a network, you know when someone is struggling and you can pick them up before things turn for the worse, especially with mental health conditions, for example. Make sure that everyone is getting, basic necessities like food. Make sure, if someone is not got good mobility and may need help with a few things, make sure you're there to help them with what you can, but without compromising the national lockdown rules and going entering the premises. Maybe, for example, dropping off some shopping, some things like that.